Alright, now I'm gonna be counterclaiming about this one claim. Excessive pharmaceutical drug exposure negatively influences people, particularly the younger generation. The advocate's secondary claims were people are becoming over-medicated and overdiagnosed by doctors. Second, prescription drugs are becoming much more prevalent and available to the public. Thirdly, children are being started on drugs at an extremely young age and forming addictions and reliance on these drugs. My claim is that exposure to pharmaceutical drug has no negative influence on people. Taking that overdose accidents are caused from negligence, and prevalent drugs are actually helpful, and things that put children in danger are actually simply caused by a syndrome, a certain syndrome that I'm going to introduce later. The first claim that people are becoming more medicated and overdiagnosed by doctors. NIH, National Institutes of Health, states that drugs prescribed by a doctor are safe as long as doctors have the right information about the patients. Doctors ask questions about the patient's condition, health, allergies, other medications they have been taking. And whether a doctor has right or wrong information about a patient has nothing to do with the exposure of pharmaceutical drugs. It is just something called negligence. But I actually do agree that excessive use of medicine is very dangerous. But you gotta, this is just a side note that I want to introduce you to. It's excessive amount of water taking is also dangerous. So I'm trying to say that excessive of anything can be dangerous. Excessive water can cause water intoxication and other serious stuff. And another example of overdose that causes harmful effects is the New York Times covered the case of Ronald MacGyver, who killed some of his patients by prescribing way too much dosage of drugs. Yet this is just one insane doctor's false behavior that caused such disaster, but not overexposure of pharmaceutical drugs. Secondly, the advocate claims that prescription drugs are becoming much more prevalent and available to the public. I'd like to say this is actually more of a positive effect of pharmaceutical drugs. A website called procon.org acknowledges that anxiety and insomnia are serious disorders and need to be treated acutely before they create more harmful situations like constant exhaustion, unreasonable aggression, and possibly death. And for business people nowadays, busy people nowadays, prescribed drugs is actually a simple and convenient method to treat these disorders. And the fact is that most of the people that purchase anxiety and insomnia treatment drugs get the information about the medicines via advertisements or so-called excessive exposure of pharmaceutical drugs. There was still a first claim, sorry. And the second claim, which let me reiterate, prescription drugs are becoming much more prevalent and available to the public. In the advocate's claim of fact, she claims that prescription drugs becoming too prevalent and available to the public is causing negative effects to people, but I would like to say it's actually a positive effect. It is good to have more prevalent and available drugs because there are demands that the government healthcare cannot meet at all. Unlike many European countries and Canada, America's drug prices have skyrocketed over years. To quote US PIRG, which is the Federation of State Public Interest Research Group, they said, today nearly 46 million Americans under the age of 65 lack health insurance, and millions more with insurance lack prescription drug coverage. It doesn't sound too good, right? And getting a prescription from a doctor and ordering drugs online will be of significant help to the U.S. citizens' financial problem. Plus, the New York Times report that life expectancy at birth increased to 77.3%, and death from heart disease, cancer, and stroke, the nation's leading killers, declined after a big boost of medicine use since 2002. The third claim, she claimed that children are being started on drugs at an extremely young age and forming addictions and reliance on these drugs. Well, the advocates claim that children, while this is a very serious issue, this does not have much to do with excessive exposure of pharmaceutical drugs, but rather kids being able to easily open a bottle of drugs without knowing the content and instinctually taking them to their mouths. In one of her evidence, in one of the advocates' evidence from Consumer Reports News, it tells that 95% of the accidents involve self-discovery, self-ingestion, or over-the-counter drugs. Based on this data, it is safe to say that regardless of the frequency of exposure to drugs, once kids find the drugs, they're going to try them anyways. This strange behavior of taking things to their mouth is called a pica, which is explained by Petty English, natural science. This syndrome is caused by a hunger at a young age or high lead level in blood. Well, it's not by being exposed to drugs anyways. So then the solution would not be on reducing the rate of exposure of drugs to kids, but obstructing kids from trying drugs. So there are some few suggested solutions, which were making drug bottle harder to open for kids, or to change the colors of the bottles according to the level of dangers. For example, red being very dangerous drugs, green being more fairly just like vitamins or nutrients. In conclusion, my opponent relates her secondary claims to whether relevant evidence shows lack of in-depth research and biased view that try to convince others simply exposing information to people causes great harm. It is safer to say, though, overdosing pharmaceutical drugs is dangerous, exposing more information about medicine benefits society. Thank you.
Right, well, the structural stuff is good, but it's a little bit confusing. Sometimes I think you've got the analysis of the advocate's argument right on target, and other times I think you're off on a separate tangent that doesn't really make much sense. That whole last section where you're talking about the kids taking the pills and relating it to Pica, that just, I don't think that's what the issue was that the advocate was talking about. I ran into some of the same problem earlier when it sounds like you're suggest, where was it? Which point was it? On the healthcare issue, where you in essence are suggesting that there is a separate problem here, that people need to have greater access to the drugs. Well, I did like the follow-up argument that you had on that suggests that greater access to a variety of drugs is having a beneficial effect, and you quantify some impact of the like on heart disease, for instance, but the drugs that the advocate is talking about seem to be less that way, and you make some general references to insomnia or sleep disorders, and then there's no follow-up on that. Let me see. One of the problems that I think you have is from the very beginning you start giving us counterclaims before you really explain what it is that the inference of the advocate is. We need to understand what the advocate's inference is so we can see how your counterclaims apply. Sometimes they really are pretty effective, and other times I don't know what the point that you're making is. For instance, on that first point where you're talking about the excessive use of drugs, and then you draw this analogy to excessive use of water and how excessive use of anything can be problematic, and I'm going, okay, so how does that apply to the claim that the advocate was presenting on this point? I don't know. On other points, though, I think you've got some interesting responses. So it just seems like you are not doing enough analysis of the advocate's arguments. You're looking for random counterclaims. Sometimes you hit the mark, sometimes you don't hit the mark, and you need to be a little bit more on target on those. All right, thank you.